Anxiety disorder affects people all over the world. Studies show that 28.8% of Americans have an anxiety disorder, and 5.7% have generalized anxiety disorder.
Anxiety is a feeling of worry, nervousness, or unease, typically about an imminent event or something with an uncertain outcome. Anxiety disorders are a group of mental disorders characterized by excessive feelings of anxiety and fear, where anxiety is worrying about future events and fear is a reaction to current events. These feelings may cause physical symptoms such as a racing heart and shakiness. There are various forms of anxiety disorders, including generalized anxiety disorder, phobic disorder, and panic disorder. While each has its own characteristics and symptoms, they all include symptoms of anxiety. For our project, we are focusing on generalized anxiety disorder. Anxiety disorder does not only affect the person who has it, it also affects the people around them.
How you feel is affected by the company you keep, whether you're aware of it or not. Studies show that emotions are contagious. We quickly catch moods from other people. Also, other people can be affected by your mood too, even from strangers who never speak a word. The people you spend a lot of time with have an even greater impact on your mental state. Now that we know what generalized anxiety disorder is and how it affects others, let's take a look at how it affects you by talking about the long-term difficulties associated with the disorder. First off, anxiety disorders are highly treatable, yet only about 1/3 of those suffering receive treatment. This is because some people who have generalized anxiety disorder do not know that they have it. So let's go over the symptoms of the disorder and the long-term effects so you can recognize it sooner and get treatment. Personalization.
Labeling.
Shoulds and should nots.
Emotional reasoning.
Catastrophizing.
Jumping to conclusions.
Diminishing the positives.
The mental filter.
Overgeneralization.
All or nothing thinking. There are long-term consequences related to this. Evidence suggests that people with anxiety disorders are at a greater risk for developing a number of chronic medical conditions. They may also have more severe symptoms and a greater risk of death when they become ill. The feeling of anxiety is thought to arise in the amygdala, a brain region that governs many intense emotional responses.
As neurotransmitters carry the impulse to the sympathetic nervous system, heart and breathing rates increase. Muscles tense, and blood flow is diverted from the abdominal organs to the brain. In the short term, anxiety prepares us to confront a crisis by putting the body on alert, but its physical effects can be counterproductive, causing lightheadedness, nausea, diarrhea, and frequent urination. And when it persists, anxiety can take a toll on your mental and physical health.
Did you know that 40 million people in the U.S. will experience an impairment because of an anxiety condition this year?
Are you aware that only 4 million will receive treatment, and of those, only 400,000 will receive proper treatment?
And did you know that those who experience anxiety and stress have a very high tendency for drug abuse and addictions?
So, what causes generalized anxiety disorder?
So, for the most part, with every mental health condition, there's always a genetic factor and an environmental factor that go into it. With generalized anxiety disorder, most often you'll see it expressed when there are different triggering events. So there are different types of anxiety disorders. I'm sure you guys have found that out. And so like generalized is the one that where kind of you're just consistently anxious over a course of time. Whereas something that might be, like if you were looking at something like a post-traumatic stress disorder or something like that, your anxiety is really set by one trigger. Or you have test anxiety, it's set by one specific thing. So generalized anxiety is kind of where you're at that heightened state for a longer period of time, like throughout the course of the day or an evening, and there isn't necessarily one specific reason or one specific trigger. Like there's multiple factors that come into it. So with generalized anxiety disorder, there is both that kind of component of genetic factor where you're probably predisposed to it based on your parents, and then also how you have learned to cope with different events. So you'll find that children who have had who have experienced trauma in their life are sometimes at a little bit more of that heightened anxious level. And trauma can be anything from they were in a fire or they were homeless or they witnessed a lot of violence, whether it was in a home or at another setting or that sort of thing. So different environmental factors like that.
Okay. So, what treatment options are available for generalized anxiety?
There are probably two combinations, two things. There's always like medication therapy, and there's also like cognitive behavior therapy or like psychotherapy, so where you're going in and you're seeing a counselor. And typically what they would do is they would try to work on developing better coping strategies with you. So when you do start to experience anxiety, how do you handle it? Are you like you acknowledge anxiety, you can practice different breathing exercises or a lot of self-talk, that sort of thing.
Okay. How is generalized anxiety disorder different from other types of anxiety?
Like I said, kind of said before a little bit, generalized anxiety disorder is kind of a broader spectrum level of anxiety where you're kind of going through your whole day or a set period of time where you are at that heightened state, and so you're kind of anxious and wound up a little bit. And have you guys talked about any of like the triggers of anxiety, like what it looks like or what it feels like, that sort of thing?
Yeah.
Okay. So it's kind of like those states and that level of heightened where your sensory system is kind of on that high alert for that extended period of time. Whereas if you have a specific phobia or you have like for example, some people are scared of social situations, and so that like a social situation might be something that makes you anxious and you need to step away from that. So generalized is more of that broader spectrum, and then you can have more specific anxieties that are related to specific triggers.
As a therapist, what are some of your experiences with generalized anxiety disorder? Like, have you had any first-hand experience in treating it?
So my role is a little bit different than the therapist that you would see outside of the school. I don't consider myself a therapist. I do short-term check-ins, and I can kind of work with students in one-on-one to help develop strategies and that sort of thing for coping with anxiety. So I have seen it, and I am able to recognize it. Then if I did recognize it, I would probably refer out, meaning I would let parents know that this is a concern, and so they might want to seek out additional treatment. I'm here for kind of that basic level of support, and I will work on strategies and help support students in that way. But my role is a little bit different than an actual therapist.
Can you go through what a therapy session for generalized anxiety disorder would look like? What would be like?
So the first session is always kind of building rapport. So getting to know the students, helping them feel comfortable in here, because it can be really scary to talk to somebody that you don't know. So kind of focusing on that, and then after I've built a relationship with the person, then we can start talking about different strategies. So what I do is I will go through different breathing techniques that they can do, come up with different self-talk types of strategies. We'll go through different events, so specifically what causes what. You know, for example, I have if there's a student that is nervous about being in English class, that's not necessarily as generalized anxiety, but, if that's something that really is a huge trigger for them, well, let's step out of the English room for a minute, okay, and then slowly we work our way back into being in that English room.
Okay. Do you see this type of anxiety in patients more than any other type of anxiety?
No, I don't think so. I think it's usually, there's usually more specific triggers. But like I said, I'm not doing any formal diagnosis here, so I'm going just kind of based on when I meet somebody and, what kind of is the issue at hand and that sort of thing.
Okay. Through our research, we found that anxiety affects not only the person who is diagnosed with it, but also the people around them. So our last question is, how has anxiety affected your life?
I think in general that I end up working with in a lot of really challenging emotional situations. It is hard sometimes, when you hear all the different stuff that's going on in people's lives, or when you're helping helping people learn how to cope with different things. I think some days it feels really hard, and got to make sure I get my run in or my my exercise in to kind of like release that level of stress. But it can also be really rewarding when you see them make progress and when you see them be successful. And that can be really, really exciting too. So, yeah, as somebody who works like in this field, you have to make sure that you take care of yourself too. So that means recognizing when your own stress levels are getting too high, and making sure that you have good, healthy habits to be able to handle it.
Okay, so that was the last.
Thank you.
Questions,
Thank
you guys. I'm really impressed.